100,000 deaths from COVID-19. Almost 4,500 fatalities were reported on Sunday. But the government says the rate of infection is slowing. The virus has completely overwhelmed health.
Mr. Bharat, stand by.
Thank you.
India's appeal for emergency assistance, the delivery of oxygen, hospital supplies and medicine appears to have made little impact on the number of deaths. Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School. Good to have you with us. When we look at the situation in India, we're being told now that the rate of infection is slowing. Do you think that's the case?
Well, in the major cities and conurbations, perhaps the case numbers will go down because the big pulse of infection has already come and gone. However, in the small villages, cities, and far away distant towns, the case numbers will still be rising, because what has happened is the workers, fearing that a lockdown was imminent, would have left the big cities and traveled to their little villages and cities and taken their infections with them. So the key is the watchfulness in those smaller cities in India.
We're also hearing that there's a rising incidence of another infection, a fungal infection called black fungus. Nearly 9,000 cases have been reported. Tell us more about that.
So this is called mucormycosis, and it has a very high fatality rate, up to 50%. It is very, very serious. And unfortunately, it is an example of a perfect unfortunate storm. So we have people with immune suppression like diabetes, and then unfortunately they are treated with an excess amount of steroids, further suppressing their immunity, and then finally they get COVID-19 disease, which further suppresses their immune system, and unfortunately they end up with mucormycosis infection, which can be an infection in the back of the throat, eye, chest, abdomen, skin, brain, etc. And it is very serious, high case fatality rates.
It's interesting that until now there's been very little criticism of Narendra Modi's government within India. That seems to be changing. People are now asking questions about why the government isn't doing more. What do you think about the Indian government's handling of this, and what should they have done to contain the crisis from getting this bad?
So it's very unfortunate to have relied on modelers and that false premise that India has seen the back of the virus, and that false self-belief that there is a special immunity amongst Indians. So what happened in the early months was the case numbers came down because the restrictions were in place, and then Indians started to rely excessively on modelers who told them all is well. And by the way, these modelers, I'm not criticizing the modelers per se, but what I'm trying to say is modeling can get it very wrong. And in India, they have got it wrong. And what should have really happened is that when the case numbers were down in India, you prepare for a potential eventuality that the case numbers may go up again. And that bit of additional preparation when good times were there didn't happen.
Dr. Bharat Pankhania, thank you very much indeed for joining us.
Thank you.
Well, in Japan, doctors are warning the healthcare system in the city of Osaka is in danger of collapsing. A large wave of new